we use IVs that I mix. I determine how much vitamin C, I determine how much glutathione, I determine how much magnesium. Whatever goes into that bag, I have determined. Hi, I'm Dr. Benincasa-Feingold, and this is Valley Health and Hyperbarics. Absorption is difficult because of an inflammation of the gut. Ultimately, we work perfectly. We shouldn't be inflamed, and everything that goes into our mouths should eventually be digested and then absorbed. But we have a lot of people that, for example, are taking antacids because they have some reflux. Well, antacids then prevent things from getting absorbed correctly. Or if you have like chronic inflammation, like chronic viruses, chronic bacteria, like things like Lyme, or if you just because you've been sick, you have a depletion of your natural antioxidants that you make. But the administration of nutritionals via an IV makes sense in patients that have chronic inflammation, who have digestive issues, may not be able to absorb nutrients as well. And therefore, giving them glutathione. Glutathione is an antioxidant. If we ingest glutathione, glutathione is not absorbed well. However, if you give it directly in the vein, it's obviously right there in your bloodstream, so you can reach levels that are much higher. And in some cases, especially patients with a chronic inflammation, you may get immediate relief. It's very safe if you're monitored closely, like everything else in medicine. If you allow an IV to go in really fast, if you don't encannulate a vein and you go outside of the vein, of course you're going to get some side effects. But for the most part, IV nutritionals are very safe. You just have to do it slowly, and you see if you're in the vein, then it's pretty safe. So the first thing that you need to do is make sure that the place is clean. There are a lot of these pop-up clinics now where you can just go in and get an IV treatment, and they have a remote doctor that screens you, and then you get your IV. We haven't been like that. We've been established now for almost 26 years, and I feel strongly about having been trained in it. You have to take courses in IV treatments, IV nutritionals. Documentation is very important, documenting why you're doing certain things. You have to be properly trained. And it's not to say that these places are not properly trained. They have cookbook cocktails to give, but the doctor's remote, and you don't really establish a doctor-patient relationship. So we don't use pre-mixed IVs. We use IVs that I mix. So I determine how much vitamin C, I determine how much glutathione, I determine how much magnesium. Whatever goes into that bag, I have determined. It's not a pre-mixed bag. It's based on the age of the patient, the size of the patient, and the condition. There are times that I want to give more magnesium. There are times that I want to give a lot more vitamin C. It depends on what we're treating.